So gonadotropin is a hormone which is very, very important for ovulation to take place. In chemistry, Cu, it is a chemical name for copper. Cu stands for copper. Always remember, sterile means infertile and fertile means capability to produce the egg or the ovum. Hello everyone, welcome to another session on reproductive health. I am Dr. Divya, Biology Faculty, Vidhyaashram Pre-University College, Mysuru, Temple of Excellence. So in the previous session, we had studied about the reproductive health program that was initiated by the government in the name of family planning in the year 1951. And the credit goes to the Indian government to be the first country to implement such programs related to the reproductive health and also the child welfare. We also studied what all plans were or programs were looked after or looked upon in that particular that is reproductive health and child awareness program, and also what all different changes that have occurred from the day the program was implemented till date. So in today's session, we shall study about the population explosion. So population explosion, I told you, because of various plans and various improvements in the medical technology related to the female and also related to the good health of the child, the mortality rate of the mother as well as the child has decreased drastically. And also, even though in spite of the government bringing about various education related programs in order to make the people understand that it is better to have only one or two child in a family, the people are not looking upon it. Because of all these reasons, there has been drastic increase in the population, which is called as population explosion. So when you consider the population of a country in the previous years, that is during the time of independence, it was very, very less. But now it has increased drastically from million to billion. So the development in various fields such as improved quality of life of the people and the health facility provided to the people and the better living of the people or better living conditions of the people have resulted in an explosion or an increase in the population of the country, not just the country or the whole world as such. So what are the reasons for population explosion? So there has been a rapid decline or a reduction in the death rate of the maternal as well as the infant. That is, the death rate of the mother, or it is in other terms it is called as the maternal mortality rate, which is MMR, and also the death rate of the infant or the child, which is called as the infant mortality rate. There has been a drastic decline in this particular death rate or the mortality rate. Why is this drastic decline there? Because of various improvements in the hospitals, in the care that is provided to the mother during her childbearing age and to the infants, as well as increase in the number of different technology, laboratory related technologies or hospital related technologies. Because of all those things, the death rate has drastically reduced. So, and reduction in the death rate has increased the population of a society or a country or the world. And also, there is an increase in the number of people in the reproductive age. So there has been an increase in the number of people in the reproductive age, and especially India is a country which is filled with youngsters. So all the youngsters, when they come to a childbearing age, then the population will again increase drastically. Why? Because if a country has more number of youngsters, then there will be increase in the people, which is nothing but it means that there is an increase in the people of the reproductive age or the childbearing age. So all these factors are the ones which has created a population explosion. Population explosion has a major role. It plays a major role to a society. Why? Because it brings about a lot of problems. So it causes shortage of food. So in a family, I'll explain it to you just taking the example of a small family. So in a family, say for example, there are 5 kids and only the father is the one who's able to bring an income to the family, or he is the only bread holder of the family. Then what happens is he will not be able to work and get so much of money to take care of the family or to feed the family. So why at such times there will be shortage of food to the family. Not just that, when we consider a country, if there is lot of people, say for example, a natural calamity has occurred. Say that particular year there was a drought and the farmers were not able to produce the food that is required to feed the people of a country. During such crisis, what happens is if the population of the country is too much, there will be shortage of food. So that is one of the reasons. And one more is unemployment. So in every company, say they hire about 100 people, say there are 10 companies, they hire about 100 people, where will the remaining people go for job? Right? Any job for that matter. You cannot, for a place where the workload of only one person is required, you cannot add extra hands, or you cannot take in 5 or 6 people, right? So in such condition, if the population is very, very more, there will be a chance of an unemployment. So unemployment again will cause a problem to the family, right? So all such things will happen. And next is difficulties in providing education. So if in a family you have either 1 or 2 child, it is easy to educate the people. So especially the best example I can give you is the corona crisis which we are facing now, the coronavirus, right? Many people have lost their job. The economy of the country has declined. Even though people are having jobs, the government or the company is not able to give the employees their regular pays, right? It is difficult. So during such times when the parent is not earning enough money, during such epidemic conditions or pandemic conditions, when the parent is not able to earn enough money, how can they provide education if in a family more than 2 kids are there? It is very difficult to meet the expenses, right? So if there is more population explosion, what happens? There is difficulty in providing education. So this best example. Not just that, also in a school there will be a limit that only so much amount of student you should put in a classroom. So where will the other kids go? If there is too much of population of youngsters or the kids of that particular age, it will create a problem there also for the education. And also it will bring about population explosion, will bring about poverty. So all these will cause poverty, especially unemployment and difficulty in providing education will also cause poverty. So if there is more number of people in a country, more number of population, the country's population is more, then the people will be unemployed because the government is not able to provide them the job that they need. There is no workload for them. So at that time what happens? Indirectly it will lead to a decline in their income and therefore leading to poverty. And not just that, if there is population explosion, I told you there will be difficulties in providing education. So if education is not given to a child, in the future he may not be able to get a good job wherein he can earn a good amount in order to take care of his family. So therefore that will also lead to poverty. So these are the different effects of population explosion. One is shortage of food, the other one is unemployment, the other one is difficulty in providing education, and also poverty. So that is why we should always keep in mind That is, the government has a rule, hum do, hamare do. You might have heard about it. Even in the theaters and all, during advertisements, all these slogans come up. Hum do, hamare do, which is a plan that is put forth by the government. And in order to put forth that plan, the government has given incentives to people or rewards to people, saying that if you have only one child, the best example is China. China, they have brought about various policies, right? If you have only one, because China's population is too high, because China stands number one in the population, right? So they have brought about a new plan wherein they have said that if only one child is there, the education, the hospital, everything will be provided new to the child. So in India also, such plans have been implemented in order to prevent the population explosion, or to limit a family to have only one or two children. So this is about the population, or the effects that overpopulated country has to face. What are the effects? One is shortage of food, the other one is unemployment, then you have difficulties in providing education, and the other one is poverty. So in order to prevent all these, various control measures have been taken in order to prevent the population explosion, or to bring down the population of a particular country. So the first one is, government, they have set up various plans and strategies in order to motivate or educate the people to have smaller families. So I have told you, they provide incentives to the people, and they they make them happy, saying that if you have a small family, I'll give you certain reward, maybe in the form of money, maybe in the form of an education to the child, maybe in the form of a hospital facility, or maybe insurance to the child, all that. So to motivate smaller families is one of the control measures taken by the government. The other one is to use various contraceptive methods. Like you have various contraceptive methods, natural contraceptives, barriers. All these contraceptive methods can be adopted, wherein by using them you can limit your family to just one or two kids. And next is statutory. The next one is statutory raising of marriageable age. So you know that now the women, if they have to, the young female, if she has to be of marriage age, she should be of 18, and the boy should be of 21. Why is it so? Because of course age matters here. Why is it? Because a girl is said to be matured. So matured, it is not just maturity in the case of the body, but it is also maturity in the head. So when she is matured enough to think about the problems in her life and all that, like they will be able to think and analyze and better understand that they should be able to limit the number of children to either one or two. So that is why the government has increased the marriage age of a female to 18 years and that of male to 21 years, because they would have attained maturity by that particular age. And next is providing incentive to couple with small family. So say for example, there are two neighbors. One neighbor has 3 kids and the other neighbor has either 1 or 2 kids. So the 1 or 2 neighbor having 1 or 2 kids will have different facilities from the government. So the other neighbor will start thinking, oh, I should have followed the same thing, so that even my child would have got education for free, or would have got a better healthcare facility for free and all that. And this word will spread to the other people, saying that the government is going to provide rewards for whoever has a very small family, wherein the number of children is limited to 1 or 2. So such incentives given by the government to the couples who are having small families all will prevent the population explosion. So all these are the different control measures that are followed in order to control the population. So we'll study about the main important control measure that is followed in order to control the population, which is mainly dependent on us. So the government has implemented this policy, and it is up to us how well we can support the government. So one of the best method to control population is the birth control method. So in birth control method, there are various contraceptive methods wherein you can limit the number of child you need to have, which is the best birth control method. So here contraceptives, they should be user friendly. So the contraceptives, they should be designed in such a way that they are user friendly to the people, and they should be easily available with the pharmacists, or in some of the states you might have seen there are vending machines wherein just like how you go to your ATM vending machine, and then you put your card in the slot and the money comes out. Just like there are various vending machines wherein you have the contraceptives, so that people will not feel shy. So those people who feel shy to ask somebody or to ask a pharmacist for a contraceptive method, they can easily go to the vending machine if it is available in that particular region, and they can use that. So it should be made easily available to the people. One more is they should be effective. You like sell a contraceptive, the pharmacist or the government sells a contraceptive which is of no use. In spite of using that contraceptive, still you're not able to limit the number of children, the number of childbirth to just 1 or 2. Such contraceptives will be of no use. So it should be effective, and and in other terms, it should not affect the health of the person. So it's just like a medication. Any medication you take, it should solve the problem, and the side effect should be very, very minimal. So effective in this case also, it should solve the problem, or it should be a best contraceptive method. It should be very effective, and it should not cause a problem to the health of the female or the male. Next is reversible with no or least side effects. So I've already explained to you in the previous point itself. So this is also one of the best how a contraceptive should be. That is, it should be reversible, and it should have reversible with very little side effects or no side effects at all. And also it should not interfere with the sexual drive or the desire of the partner or the individual, whoever is utilizing it. So all these should be taken care of. These are the different things that has to be put forth when developing a contraceptive, so that it can be called as the best way or the best method to control the birth rate, or a best birth control method. So we'll study about what are the different contraceptive methods that are available. So we have the natural method, natural or traditional contraceptive method. We'll study about this in the coming slides in detail. So we have the barrier method, we have the IUDs, that is intrauterine devices, and we have oral contraceptives, oral something that is taken by the mouth in the form of a pills, and you have injectable contraceptives wherein various hormones such as progesterone and all that are injected in order to prevent the birth of a child, or in order to prevent fertilization, or in order to prevent conception. And here you have various implants are available, and also there are various surgical methods. So each of these methods, that is the natural or the traditional method, the barrier method, the various intrauterine devices, the oral contraceptives, the injections or injectables, and the implants and the surgical methods, about this we'll study in detail. So first we'll talk about the natural methods. So in natural method of contraception, it actually prevents or it avoids the chances of the ovum and the sperm meeting. So when you follow this particular natural method of contraception, what happens is, you know that how will a fetus be developed, or how will an embryo develop inside the uterus of a female? The sperm has to go and fertilize the ova and the egg, right? Only then the fetus will be developed, and after 9 months of pregnancy, the child will be born. So this is how it takes place. So how can you prevent this? By using the natural method of contraception, wherein you can avoid the chances of the ovum or the egg and the sperm from meeting each other, so that the fetus development or conception, or the women will not get conceived or she'll not get pregnant. So this is what you can follow. So under this, there are 3 types of natural or traditional methods of contraception. One is the periodic abstinence. So periodic abstinence is nothing but, you know that during her menstrual cycle, the woman, her menstruation starts from the first day to the 28th day. It is the menstrual cycle, right? So the bleeding takes place in the first 4 days or 4 to 5 days or 3 to 4 or 5 days, and next is on the 14th day is the one wherein she'll start producing the egg, right? So on the 14th day, you should avoid intercourse. So that is nothing but periodic abstinence. So periodic abstinence is nothing but on the 14th day, which is the day where the ovulation takes place, 14 days, and after that a few days, you have to prevent the sexual intercourse from taking place. So this is one of the natural method. And one more is withdrawal or coitus interruptus. So before the penis, it sheds or it releases the sperms into the vagina of the female. Before that itself, you can withdraw the penis or coitus interruptus. So this is one of the best method. And one more is lactational amenorrhea. So in lactational amenorrhea, you know that the mother, when she gives birth to a child, her mammary glands will produce milk, right? So when milk is produced, why milk is produced? It is because of a hormone called as prolactin. So this prolactin secretion, once it increases, what happens? So as the mother is breastfeeding the child, so till the time she breastfeeds her child, the level of the prolactin will increase. So that increase in the level of the prolactin, it will decrease the gonadotropin. So gonadotropin is a hormone which is very, very important for ovulation to take place. So when gonadotropin secretion completely stops, the ovum or the egg will not be produced. Therefore, the mother will not be able to, she'll not be a childbearing. She'll be infertile up till that particular time. So that is one of the best method followed by the female, that is during childbirth. So that is one of the best method followed by the female. That is, once a child is born, she will continue feeding her child up till a certain year. Once she starts feeding the child. So this particular natural method of contraception is only temporary. It is for 6 months. After that, the prolactin production will become less. Therefore, the gonadotropin hormone level will increase, and therefore the ovum production will start in the uterus or in the ovary. The egg production or the ovum production will start. So until she is breastfeeding her child, say for about at a stretch of 6 months, the prolactin level will keep on increasing. So once the prolactin level increases, the gonadotropin level decreases. So when the gonadotropin level decreases or the secretion of the gonadotropin completely stops, at that time the egg will not be produced. So until the egg is not produced, she will not be able to get pregnant or conceived. So this is one of the best natural methods or traditional method of contraceptive that can be used, which is called as lactational amenorrhea. So next we'll move on to the barrier methods. So in the barrier method, here also you are creating a physical barrier wherein you'll prevent the sperm from meeting the ovum. Therefore, if the sperm is not able to meet the ovum, then fertilization will not take place, and if fertilization doesn't take place, the fetus will not be developed, or in other words, the woman will not become pregnant. So that is one of the best methods for under barrier method is the condoms, and in the case of male, he can use a condom, or in the case of female, they can use diaphragms, cervical caps, and also vaults. So these are the different barrier methods that they follow. So in the case of barrier methods, the most important physical barriers that can use in order to prevent a lady from being pregnant is the condoms, which can be used by the male, and the females, they can use the diaphragms, the cervical caps, as well as the vaults. So next, we also have various other methods to prevent contraception, which is called as IUD. So IUD, it is nothing but intrauterine devices. So these are very small devices that are inserted inside the uterus. That is why it is called as intrauterine devices. So these intrauterine devices, they are of different types. So one is the non-medicated intrauterine device. The best example is Lippes loop. So Lippes loop, this is Lippes loop. So if you can see, this Lippes loop, it is S-shaped. So it is shaped, and this is made up of plastic. It is a very simple instrument, and you have a thread-like string here, which can be tied. So here, once you insert this inside the uterus, it will cover the uterus. Say, I'll just show you. Once you insert this inside the uterus, it will completely, see, it is like this. It will completely cover the uterus. It will completely cover. So what happens is, if you have a sperm here, so when the sperm is trying to move inside, it is covered. The complete uterine cavity will be covered. So that is when the sperm cannot move, travel and reach the egg. It will be stuck here because in such a way, very neatly it will get covered. So this is the function of the Lippes loop. So one of the best contraceptive method is the non-medicated IUD, that is the Lippes loop. So why it is non-medicated? Because in some of the IUDs, it is filled with hormones. Those IUDs will start to secrete hormones because it is filled with hormones. But in this case, nothing like that is used. It is with no chemicals. It is with no hormones. Only thing is, this Lippes loop will entirely cover the uterus. Therefore, whatever sperm is trying to enter into the uterus and reach the ovum or the egg, it will not be able. There is no gap at all. Because of no gap, it will not be able to travel here. Therefore, the lady or the female will not get pregnant, or the sperm will not be able to meet the ovum or the egg. So next, one more best contraceptive method is the copper releasing intrauterine devices, such as the CUT, that is CUT. You have CUT, then you have CUZ, and you have multi-load 375. So CUT, I'll tell you what it is. So CU means copper. So because this intrauterine device, it is a copper releasing IUD, that is why they have named it as T. T means it looks like a T. So you can see here very clearly, it looks like a T. That is why it is called as copper T. And one more intrauterine device that releases copper ions is there. It is called as CUZ. And you know that in chemistry, Cu, it is a chemical name for copper. Cu stands for copper. That is why it is named as CUT. And you have one more called as CUZ. There is also one more copper releasing intrauterine device, which is called as multi-load 375. Why it is called multi-load 375 is, this number is what depends on why it is called multi-load 375. So the copper wire that is used, it is of 375 millimeter square. So the length of the copper wire that is used in this particular device, it is 375 millimeter square. That is why it is called as multi-load 375. So in copper releasing IUDs, you have copper T. So this is the best example. Can you see here? Here there is copper. So here also you have copper, and even here there is copper, and it is T-shaped. So once it is inserted, there is, in this case, gaps are there. There are gaps wherein the sperm can pass this and enter and reach the ovum or the egg. But what happens is, this copper wire, it starts to release copper ions. So when it starts to release copper ions, these copper ions, it will cause phagocytosis of the sperm. So phagocytosis is nothing but disintegration or death of the sperm. So therefore, once the sperms die, they will not be able, and not just that, it will also reduce the motility, that is movement of the sperm. So the sperm, it has to swim through the vagina, through the cervix, and it has to enter into the uterus and reach the egg, right? But here what happens, this copper ion, it will decrease the motility, or it will decrease the movement of the sperm. So when the sperms are not able to swim freely or move, they will not be able to reach here. So this is the mechanism of the copper releasing intrauterine devices such as the copper T, the copper Z, and the multi-load 375. So why is it called multi-load 375? Because the copper wire is about 375 millimeters square. And one more, you have one more intrauterine device which is called as hormone releasing intrauterine devices such as progestastor and LNG20. So hormone releasing means they have the capability to release hormones. What kind of hormones? Be it progesterone or be it LNG20. So this LNG20 is very, very important because LNG20, it consists this particular IUD, that is hormone releasing. So this is the best example for a hormone releasing IUD. So this is a hormone releasing IUD, and you have already read Lippus loop, and this is the copper T. Copper T. So this IUD, hormone releasing IUD, it is filled with hormone inside. So up to a certain month, it will be releasing the hormone, therefore which prevents the implantation of the ovum. Even though if the egg gets fertilized, it will not be able to implant in the uterus, and also it will prevent the sperm from reaching the uterus, therefore moving through the fallopian tube and reaching the ovary or the egg. So here in there are two types of hormone releasing IUDs. They are called as progestastor and LNG20. So in LNG20, it consists of two hormones. One is levonorgestrel. So levonorgestrel, it is made up of two hormones, one in the synthetic form, that is synthetic progesterone and synthetic estrogen. So these two hormones, they actually cause prevent the motility of the sperm, and they also cause phagocytosis of the sperm, and apart from that, they will also ensure that it makes the uterus non-hostile for the sperm. That is, it may bring about a change in the cervical mucus. You know that all females in the cervix, they have mucus secretion, and that mucus secretion is also very important to determine the fertility of a healthy reproductive individual. So here what happens when there is change in the cervical mucus, maybe the mucus may become too thin in consistency or too thick in consistency or watery or whatever. In such cases, it will become a non-hostile environment, or it will not be a good environment for the sperm. So therefore, the sperm will get disintegrated, or it will die, or it will lose its motility. So that is how hormone releasing IUDs like progestastor and LNG20 will work. So next we have one more method for contraception, or to prevent contraception, or a contraceptive, or in other terms one more contraceptive method, which is the surgical method, and it is also called as sterilization. Always remember, sterile means infertile and fertile means capability to produce the egg or the ovum. Sterile is nothing but incapable of producing the egg or ovum, or in other terms, incapable of reproducing or incapable of fertilizing. So that is why it is also called as sterilization. That is why surgical methods are also called as sterilization. So under surgical methods, there are two types of surgical methods that are followed. One is called as vasectomy and the other one is called as the tubectomy. So vasectomy is the one that is followed in the male, and tubectomy surgical method is followed in the female. So this in the male, So it is a surgical method which is done by a good medical practitioner in the surgery room or in his clinic or hospital. It is done. So in vasectomy, what is done is a part of the vas deferens, it will be removed. So you know, these are the testicles or the testis. So it is in the testis the sperms are produced. So there is a connection between the testis, there is a connection in the testis to the penis, there is a connection. So here what happens, they will break this. So this connectivity that is there, they will cut. So this is nothing but vas deferens. So this is the vas deferens. So this tube that forms the connectivity between the penis and the testis, it is cut. So you can see here a cut has been made and knots have been tied here. Knots have been tied. So when a cut is made, the sperm, it will move till here, but it will not be able to move further, right? It will not be able to move further because there is a incision or cut. There is a barrier, the bridge between these two is broken now. So that is why it will not be able to move. So this is how, though the sperms are produced, they will not be able to reach the female. So this is one of the best surgical method that is followed in the male. It is called as vasectomy, wherein a part of the vas deferens is removed. And next one important surgical procedure which is done in female is that tubectomy. So if the male undergoes the surgery vasectomy, then also he will not be able to make the female pregnant, and also if the female is undergoes the surgery called tubectomy, she will not be pregnant. So either one of them in a family, in a couple, either the male or the female can go in for this surgical procedure or sterilization technique. So in tubectomy, a small part of the fallopian tube. So fallopian tube is very, very important because once the sperm enters the vagina and the cervix and it reaches the uterus, it has to travel through the fallopian tube, and it has to, if the egg is produced here, it has to fertilize or meet the egg, and the fertilization has to take place, and that is how the fetus develops, right? But in this case, what happens here is a small cut. So in this case, what happens here is, you can see here a small cut is made in the tube and it is tied. It is tied. So therefore, even though the sperm comes here, cannot travel further and reach the ovum. Therefore, fertilization will not take place. So this is the best contraceptive method, which is a surgical method called as vasectomy and tubectomy. So this is how vasectomy and tubectomy, they can be done in the male as well as the female respectively. So next we have some disadvantages. So any procedure or medical procedure or medical devices or tablets or whatever you take, they will have some advantages as well as disadvantages as well. So what advantage, you know that the best advantage is the female or the male will decide when they have to have a child. The disadvantage is that the selection of a suitable contraceptive method is needed, and that selection, if you have to do, you cannot just walk into a pharmacist and ask me, give me this contraceptive, give me this progesterone. Or when it comes to surgical method, you can't just walk into saying that, okay, my friend is a doctor. You can't just walk into him or her and say, I need to get the tubectomy or the vasectomy done. No, that is not possible. You should always consult a medical professional, and then only you should go in for the contraceptive procedures or the contraceptive method. So this is one of the disadvantage. You cannot take tablets or contraceptive tablets or contraceptive pills or contraceptive barriers or methods. You cannot follow by taking your own decision. You'll need the help of a medical practitioner or a medical professional. And next is the contraceptives are not regular requirements. Why? Because a couple cannot decide, we're not going to have kids for about 10 years. So you can't force the female to have the contraceptive pills or the tablets, because these tablets, they bring about a lot of problem in the health of the female. That is why it also brings about a lot of problems in her emotional as well as social as well as a physical health. Therefore, the contraceptives are not regular requirements for the maintenance of reproductive health. They can be only used for a limited time. You cannot prolongly use it. It is very bad. And they are practiced against a natural reproductive event. One of the disadvantages, forcefully you cannot make a female use the contraceptive method. So sometimes what happens is, with force, without the consent of the female will get pregnant. So at such conditions, it is up to the female to decide whether she should take a contraceptive or not. But usually what the uneducated people, what they do is, most of the time they may force her to use a contraceptive method, so against her will. So therefore, their contraceptives, the main disadvantage is that they may be practiced against a natural reproductive event, or sometimes because of something, the woman may become pregnant, or she may conceive, and she may decide after 2 months, I don't want to have the baby because of some reason. At that time, she'll just go walk near the medical practitioner. She may bribe him or something, and she may use the contraceptive method without the consultation of a medical professional. That is, people will start misusing the contraceptive method sometimes. So that is one of the biggest disadvantage of contraception, wherein they are practiced against the natural reproductive event. And one more is, and also sometimes contraceptive pills or contraceptive methods, because all these contraceptive methods, other than the barrier method, these IUDs or various contraceptive pills that are taken, they are filled with synthetic hormones, be it progesterone, estrogen and all that. They're filled with synthetic hormones. That is, the natural hormones that are produced in the female body, the same hormones, but in a synthetic form. So such hormones may cause vomiting sensation, that is nausea. It may cause pain in the stomach or the abdomen area. It may cause breakthrough or uncontrolled bleeding during the menstruation. It may cause breakthrough or uncontrolled bleeding, and the menstrual cycle may become irregular, or even it may lead to breast cancer. So that is why nowadays most of the gynecologists, they give an extra tablet to prevent the occurrence of breast cancer whenever they prescribe a contraceptive pill, especially in female who are having this issue of infertility. So all this should be not used for a long term. It should be avoided. Why? Because contraceptives, they may cause nausea, abdominal pain, irregular menstruation period, and also there are chances of it causing breast cancer. So this was about the various disadvantages of the contraceptive methods. So in this session, you learnt about what is population explosion. Why is population explosion occurring? It is mainly because of various technologies, improvements in the technologies related to the reproductive health of a woman, and also because the decrease in the maternal as well as the infant death rate. And also we studied, in order to prevent the population explosion, or in order to bring about a control in the population, there are various contraceptive methods that are being used, such as you have the natural or the traditional method, you have the barrier method, then you have the intrauterine devices, you have the surgical methods, and also you have various pills or hormone related methods that are available. So I hope you have understood this session. In the next coming session, we'll talk about medical termination of pregnancy, wherein this is called as MTP. It is also called as MTP. So what are the drawbacks or advantages of MTP, that is medical termination of pregnancy? That we'll study in the coming session, and we'll also learn about the sexually transmitted diseases. And because of the sexually transmitted diseases, infertility will occur in a female. So what are the causes behind the infertility? What are the different sexually transmitted diseases? And how we can prevent it, what are the reasons for those STDs, all these we'll study in the coming sessions. So I hope you have understood this session very well. So we'll meet in the next coming sessions. Thank you.